Introducing Chao Pinhole Gum Rejuvenation's Pinhole Surgical Technique. Before, conventional gum grafting required cutting tissue from the roof of the mouth. The gum is then cut over the area of the recession and lifted. The tissue from the palate is placed over the recessions. Once complete, sutures hold the graft in place during healing. Now, with the new revolutionary Chao Pinhole Gum Rejuvenation, gum recession is corrected without cutting or stitches. This new process begins with a tiny entry point that is made in the gum. Then, a special dental instrument is placed through the pinhole to free the gums with gentle movements. Once free, the gums are guided down into a healthy position. When the recessed gums are corrected, tiny collagen strips are placed inside to help stabilize the gums. Incredibly, the pinhole heals rather quickly, and often overnight. When complete, the receding gums are corrected with a minimally invasive treatment that is quick, easy, and instantly pleasing.